Okay, thanks, Mark. So, just to introduce myself, I'm a consultant in public health in the Public Health Department in Bradford Council. We moved over from the NHS a few years ago, and I cover children, young people, and mental health, but also since March as well. Obviously, a lot of the COVID response. And what I wanted to do very quickly was just give you a quick update on the support that's available to you and how we want to support you in terms of managing cases and outbreaks within your school, and just quickly run over some of the main messages from infection control as well. So what you should have all received, so I work very closely with the education team within the council, and I've started to send out weekly messages to all head teachers updating you on what the current epidemiological situation is and how the pandemic's progressing in Bradford, but also some of the key infection control messages that we feel are really important for school settings as well. And you should have all received this document. If you haven't, I need to know about it, which is responding to cases and outbreaks. So there is huge amounts of information being thrown at you, I know, and myself as well. And what I've tried to do is take all the information about how you manage cases and outbreaks and the support that you receive and put that all into a single document for you. So if you haven't got that, or there's something not right about it, let me know, because we've got the opportunity over the summer as well to develop a second version of that for when you come back in September. But the basic messages from that are that if you have a possible case that hasn't been confirmed through a test, they need to self-isolate with their family at home, but no more action is needed to be done within that school. If you hear through the test and trace that there is a positive case within school, that person or that child needs to self-isolate, and then it's likely that their bubble or close contacts, so anybody that's been within 2 meters for 15 minutes or more, will need to self-isolate as well. And we need you to report that to the local authority and Public Health England, who will help risk assess the situation with you as a head teacher, and then recommend the sorts of infection control procedures that are needed. And then if there's an outbreak, we have an outbreak control team meeting, and we have those every week at the moment. So that sort of guidance should go out to you. We've tried to make that simple with all the phone numbers and email addresses as well. And that is all on page 1 of this document. And then it goes into more detail as you move forward. So just to give you an idea, at the moment, we've had about 25 schools, predominantly primary schools, but with a couple of special schools as well, where we've had 1 or more positive cases. The numbers of positive cases in staff as opposed to children are 3 times higher, so they outnumber children 3 to 1. That's probably partly because a lot of children are asymptomatic, so they might be walking around with coronavirus, but they're just not unwell. But most of the cases that we have seem to have been coming into the school from the community, from teachers at the moment. So it supports what John was saying, really, about that growing evidence that perhaps children don't have as big a role to play in transmitting the virus as adults. So we are already starting to manage some of those outbreaks, and the communication from schools back to us in the local authority, Public Health England, seems to be working. So thank you very much for that, if you've been involved in those. The test and trace system that John mentioned as well, that really started up in earnest again at the end of May. We're doing a lot more testing. Bradford's got the highest testing rate in Yorkshire. So you test more, you find more, and it enables you to break those chains of transmission. So we are starting to find more cases now, and we'll be finding out about those cases either from yourselves as head teachers, or Public Health England have a little light that shines up if you get 2 cases within the same postcode. So that also alerts us to a potential outbreak that we might trace to a school. So this document as well, if you have a look through this, it's got all contact details in. I want to develop some simple guides as well to vulnerabilities that I'm going to work with Helen, that you've just heard talking over the summer as well. So you've got really clear guidance on vulnerabilities and risks for specific children. There's a section in there about PPE, when you do and don't need to use PPE, how you can get hold of PPE. So there's an email address that you can order that from. There's a free initial supply from the local authority, and we'd recommend that all schools get some stock of complete PPE in for the start of term, just for those emergencies. But I'll come back to that. And then we've got a checklist in the back of the document as well, which is basically a 2-pager for you on infection control and the sorts of things that you might need to think about and do within the school as well. We've tried to put it all into one document. I think the main things in terms of infection control, which you'll have heard about already, are those facilities and regular reminders around hand washing and respiratory hygiene, and then enhanced daily cleaning. So I think you just really need to think about that you're in the middle of a D&V outbreak, but it's everlasting. And I know that is really, really difficult. You can't clean everything. So that's why keeping children in bubbles, only using equipment that you can wash properly and so on, keeping things in cupboards the whole time, make things a lot easier if you do get outbreaks and you have to have some deep cleaning after an outbreak. And we'd recommend a deep clean for the whole school after you close down for term at some point during the summer as well. But we recognise that you can't clean the whole school, every day. And as John said, this is just about minimising risk. We can't reduce risk to nothing. We can only try and minimise it. I think probably the other key messages are, and I've already seen a few questions coming through about PPE, whether you need to use that just for general teaching in the schools. You shouldn't need to. If a child's got symptoms, either they develop that or they come into school with symptoms, there's some basic guidance about what you do. You'd put that child in a room by themselves, and if you can't stay within 2 meters of them, you'd have some basic PPE on. We've given that guidance to you. The only other reasons that you'd need to use PPE would be because of that normal, if there's a much more sort of intimate physical relationship in terms of needing to touch that child as part of their care, you'd need to use the normal PPE, but you shouldn't need to do it apart from that. Face masks is another thing that we're getting a lot of questions on now. We've heard some schools have told children that they're not allowed to wear face masks. One of the things that's come out of the mental health work that we've done is that there's a lot of fear within the adult and the child population around coronavirus. Some children are worried, fearful for themselves, but they're very fearful for their older people that might live with them as well and their family. So I think children should be allowed to wear face masks in school, but I can answer any queries about that offline if you think there's going to be an issue with that. But I think that's needed to protect their well-being as well. And it's likely that there's going to be more and more settings now where face masks become the norm or implemented. We've already heard about that this week from the new regulations around shops. So I think there's likely to be more of that in schools. To give you an example, the Czech Republic completely social normed face mask wearing within a month for children in schools, because they decided very, very early on that they wanted to try and control infection in schools. The other questions that I get are around contaminated waste. So the same things that usually apply to contaminated waste, you need to double bag that and put that in a lockable waste container outside the room. If you haven't got a lockable waste container outside the school, that can go into a locked room for 3 days, and that will decontaminate that equipment or the waste. And then finally, ventilation. There's a link I can send you. There's some really good health safety executive information about ventilation. There's a good idea to have a chat with your school engineer or your caretaker around this. So fans are being encouraged to keep ventilation going. The likelihood of coronavirus spreading via air conditioning systems is deemed very low indeed, unless you've got the same air that's just been churned around a single room over and over again, and that room hasn't got any other ventilation at all. So even though it's obviously going to be colder over winter, if you can get ventilation going into the room, that will reduce the risk even further. But there is some specific guidance on that depending on what your ventilation system is within the school. So I think that the key messages for me are about minimising risk, and the fact that children's social development is obviously really, really important, that you'll know, as well as their educational development, and allowing them to catch up on that social development as well is absolutely crucial. One of the things that I've learned from the pandemic over the last 3 months is that people seem to describe it as a direct trade-off between lockdown, where everybody goes into their house, doesn't go to school, doesn't go to job, trade-off between that and completely opening up society. And then there's these different points in between. There is a third option, and it's the third option that we're pursuing in Bradford, which is really, really, really strong test and trace and infection control across the city. That is our way to get people back to work and kids back to school, and keep infection control rates. And anything that you do within your school in terms of your infection control, your bubbles, the way that you manage children in and out of the schools, that reduces the chances of infection being passed on. But it also means that should you get a case of coronavirus or an outbreak of coronavirus, it means that the implications of that for locking that school down really reduce as well. And the sort of advice that you'll get and the risk assessment that you'll have from Public Health England will really minimise that impaction. So it's really, really worth staying on top of that and making sure that there's somebody every day within the school who's a nominated person in the lead for these sort of measures on that day. So that's probably it for me. In terms of children coming back to school, I think the other important thing is, in terms of resilience, we've got some guidance on for children that might be living in multi-generational households. And there's obviously a higher proportion of those in Bradford than most areas, because we've got a large number of children, particularly South Asian backgrounds, that might be living in 3 or 4 generation households. We've got some guidance on that, so it's worth going through that guidance, and all the messages that you give to children at school need to be applied at home as well, in terms of that washing and safe distances. We also have the household plan. If you live in Bradford, you'll have got that through your door, which is basically about that household resilience. So this is about families thinking about the people in their houses, you know, who's got the keys for the door, who does the shopping, what how the neighbour can help you if you've got vulnerable people, who's got the information on the medications, or about household resilience as well. So that'd be really worth mentioning that to children. And then the other thing that we want to support you with as well from September is the lifestyle survey, which 2/3 of you as school signed up to last term. We couldn't introduce it last term because of obvious reasons with the coronavirus, but we're changing that a little bit, and we're putting some questions in there, and we're going to be able to give you your own school report about how children have been facing, what sort of issues they've been facing during lockdown, which will be able to give you some of the key issues for your needs assessment within your school as well. So that's probably the last thing I'll say. But the overall message is I want to keep up this conversation with schools and realise it's really difficult for you. As John says, it's evolving for us. Every day when I come to work, something different happens by the end of the day. It's really, really difficult. We just need to keep up that conversation and those questions coming through to us in public health and the local authority, and we'll support you all we can in September.